Good evening, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to the first of a two-part webinar series on mental health in high school, presented in collaboration with Somerset Healthcare Foundation's Youth Board and Friends Health Connection. Our topic for tonight's webinar is burnout and imposter syndrome. About a third of teenagers report experiencing signs of burnout, including feeling overwhelmed and stressed. About 25 to 30% of teens also describe symptoms related to imposter syndrome, feeling inadequate despite their academic or athletic success. For those feelings have compounded during the past years as a result of the COVID-19 pandemic. During tonight's webinar, we will learn more about burnout and the imposter syndrome and how to manage these feelings from Kathleen Haughey-Eannone, a certified psychiatric nurse with more than 20 years of nursing experience in the mental health field. Kathleen serves as the director of Robert Wood Johnson University Hospital Somerset's Eating Disorders Program. We are also joined by two members of the Somerset Healthcare Foundation's Youth Board, Jabeen Sheikh, a student from Ridge High School, and Nicholas Yang, a student at Watchung Hills High School. So thank you all for joining us this evening. We will begin with a moderated discussion with our three guests, and then we will open it up to questions and answers from our audience. Should you have a question for one of our panelists, please post that in the question and answer section of the webinar. So why don't we start off by having you each just share a little bit about yourselves with the audience. So Kathleen, we'll start with you.
Hi, thank you, Serena. So as Serena said, I've been a nurse for just about 23 years. I've worked in behavioral health my whole career. Right now, I'm currently the director of the Eating Disorders Program, as well as the outpatient programs here at mental health programs at Somerset, Robert Wood Somerset. So I'm excited to be here to, take part in the discussion with you guys.
Great, thank you so much. We'll go ladies first, so we'll go over to Jabeen.
Hi everyone, my name is Jabeen Sheikh. I'm a rising senior at Ridge High School, and I'm part of the Somerset Healthcare Foundation Youth Board, where I hold the position of secretary. And I'm so excited to be here today and offer a student perspective on imposter syndrome and burnout.
Great, thanks Jabeen. Nick?
Hi, my name is Nick Yang, and I'm a rising senior at Watchung Hills. I'm also part of the youth board. I hold the position of co-chair, and I'm also excited to give you this student perspective on these two topics.
Great. Well, thank you again for joining us all. We do really appreciate your time. So Kathleen, let's start by maybe having you give our audience a little bit of overview of what you see with teenagers and burnout. And if you could, please include the signs of burnout as well.
Okay, there we go. Yeah, so, burnout in general, just to give a quick definition of when somebody's feeling burnout, and I'm sure everybody can relate to this, it's usually taking on too many tasks at once to the point that you become overwhelmed, both emotionally and physically. And it gets to the point where you have so many tasks that it's, for a lot of people, impossible to do any task well because there's too much on your plate. The symptoms of burnout are very similar to what you would see for anxiety or stress, of chronic prolonged stress that's moving into anxiety. So you have GI symptoms, heart palpitations. It affects pretty much every body system. It can affect your sleep patterns. It can affect your eating patterns, and eventually it can lead to, affecting your ability to be able to partake in activities that you enjoy and things in your life that you enjoy, if not managed. It can be, very detrimental over time to leave those kinds of things unchecked and can lead to chronic health issues. And with kids in particular, particularly this generation of young adults and adolescents that we see, they're taking on a lot of things. There's sports, there's extracurriculars, there's applying for college, making sure they're in their AP classes, doing well in school. So you take for granted as you pile those things on, there's a threshold I think that everybody hits where where they've hit their threshold, they can't do anymore. And that's going to vary person to person, but burnout's a real thing, and it does have ultimately chronic consequences for it if left unchecked.
Oh, thank you. Thank you for that explanation. So Jabeen and Nick, does that sound familiar? And what has been your experiences with burnout? So let's start with Jabeen. Can you share your experiences?
Yeah, of course. Burnout definitely sounds familiar to me, as Kathleen said, as a high school student. And for me personally, this past year in the pandemic was really challenging in terms of balancing all of my extracurriculars and academics, especially in a virtual setting. And not only was my junior year my heaviest course load in terms of APs and honors classes, I was also studying for the ACT and I was starting to do college visits, which was a lot to think about at once. And I spent a little over half the year like staring at a computer screen every single day for school, which really contributed to my loss of motivation and my burnout. And I think for me, during the stretch between January and April was when I was really starting to feel the effects of burnout. And I felt really overworked and like the stress of school would never end. And I think I can speak for most high school students when I say that it's a really helpless feeling.
Yeah. Well, thank you. And I'm sure there are a lot of other students that feel that way too. So Nick, maybe you can share with us, what is your definition of burnout and how do you know when you're just burnt out, you're done?
So I would characterize burnout as being exhausted, both like emotionally, physically, mentally, like in any way. And usually I can tell when I'm burnt out, when I just don't feel fulfilled with what I'm doing, when I'm just doing my work or not even doing work, just standing there, sitting there, just standing there. Oh, I just said that. But I just lose all motivation to do whatever I wanted to do. And I just don't feel fulfilled if I do anything.
Yeah, definitely. We're definitely hearing that common theme going on. So Kathleen, then what can teens do to cope with burnout?
So, I think it comes back to a little bit of self-regulation and self-care, identifying early on that you have some of the symptoms of burnout, that, you're feeling that stress, much like the two students who are talking have described their feelings, beginning to prioritize, making a list and prioritize the things that need to get done now, things that you can push off to later. And honestly, things that you can leave behind totally. Little bit of self advocating with teachers or coaches or even your parents, with regard to this is where I'm at, this is how I'm feeling, and it's starting to affect me. It's, affecting my ability to sleep or, my stomach. And I need to be able to put some stuff on the back burner, which, unfortunately, schools sometimes have trouble understanding that, but when it's affecting your health, it's important to have a little bit of self-care and prioritize what you can and can't do, within reason of what you're able to handle at that moment. That would be, and then, self-care, doing stuff that you enjoy to help you relax and be able to, have some time for yourself to be able to reboot and do a little bit of self-soothing and whatever you need to be in a better place. I think those are probably the most important things that if you guys leave here with anything today is self-care. You're going to hear me say that a lot today.
Well, thank you. And so Nick, Jabeen, let's talk about how you all manage burnout. So Nick, what do you do when you're feeling burnt out?
So when I'm feeling burnt out, I take one of two approaches. So the first is just taking a step back, kind of distancing myself from what I was doing and just thinking about life, just not looking at work and just taking that break so that I can go back into my work feeling fully committed and fully motivated to finish. And the second approach is what Kathleen was talking about, like reorganizing and reprioritizing. So personally for me, I find it easier to organize what I'm doing in the future, and that helps me focus on what I'm doing. So I stay motivated and driven. So I definitely think that for me, motivating myself is through like organizing and figuring out what my priorities are so I can feel fully committed.
Okay, great. Thank you for sharing. So Jabeen, what are some ways that you've dealt with the effects of burnout, and what do you recommend other high school students do to cope with these effects as well?
Yeah, so similar to Nick, I usually deal with the effects of burnout by kind of giving my brain and my body time to rest and just decompress away from all of my stress and my work. And for me, I like to go on walks at the park with my dog. I like to spend time with my family and friends, listen to music, bake. Basically, all of these are really simple, but they're really effective in just giving myself time to do some self-care. And then once I've done that, it allows me to revisit whatever work I was doing with a clearer mind and like less reluctance to approach whatever it is that I was working on. And high schoolers can take the same approach. They can do whatever they love, whatever is safe and healthy. And I think it's really important that we start putting our mental health at the top of our priority list.
So good recommendations from all of you for sure. So then Kathleen, let's look at, maybe some parents and, what for parents who may be watching this, what can they do to support their teenagers?
So I think, as parents, we want to see our kids do well in all areas that they're interested in. But if you identify that your child is struggling, you see that they're, overwhelmed to the point, as Nick said, he gets to the point that he's got so much on his plate, it's hard to focus on any one thing to begin to start to do well with one task. And I think it's important to recognize the signs of stress, the difficulty sleeping, the irritability, maybe even some physical manifestations of the stress and the burnout that they're feeling. Because, the reality of it is, and we tell our patients this all the time on the unit, when you take so much on that you can't focus and do any one thing well, as well as you need to, then you're going to wind up doing poorly in all areas. So you kind of got to pick and choose with your kids what the priority items are and help them manage that. Set realistic expectations for what you think that they can do and what they can get done within timeframes, and help them achieve those within a reasonable expectation of timeframes. And that may mean too helping to manage with the school, where your child's at as well. Particularly, children who are traditionally high achievers or haven't struggled with this stuff before. And as Jabeen said, she's in her junior year, and that tends to be a heavier year. So maybe your child is doing well freshman year, sophomore year, and they hit that wall in junior year where everything is compounded and you're looking at colleges. It's good to take a step back, take stock of where your child is at, and help them prioritize, help them learn how to prioritize for themselves. And, as parents, I have to kind of put the plug out there that we have to, as parents, set that good example for our kids too. So if they see you at home taking on too many tasks, and they see that irritability and the stress and the burnout in you, adolescents and your children model behaviors after you. So it's important to do a little self-reflection on, what the home culture is too with regard to that.
Well, thank you. And you know what, you mentioned something interesting. You mentioned about the schools. So, a lot of the burnout, if you will, stems from their experiences and the demands that are being placed upon them in schools. So, what would you say, what can teachers, faculty, and maybe even the school nurses do to support students, and cope with some of this burnout?
Yeah, so, I'm a firm believer that schools, although not necessarily in COVID times with this hybrid learning, but school districts are usually the first, the teachers, the employees that work within the school districts. And it doesn't just have to be teachers, it's just staff that the kids see day in and day out more than they see their families during the school year. Pick up on some of the little nuances in, changes in personality and mental health issues with the adolescents in their care to begin with. We get when school was functioning non-COVID, we got a lot of our referrals through the school nurses for our eating disorders program and through the school districts because they saw the kids every day. So with that said, those small changes in personality, even when faced with something like burnout, when you see the irritability in the child, you see that they're overwhelmed, they're visiting the nursing office because they're having continuous GI symptoms from, the worry and the stress about this task or that task not getting done. It's the same advice I give to the parents. The school districts have to almost take stock of the pressures that they're putting on the kids. I can't tell them how to do their jobs, but as a parent I've had 3 kids go through high school. I clearly saw each one of them going through from freshman year all the way up to senior year discussions about colleges. And this is how many AP classes you need. And you need to be in a club and you need to be in a sport. You need to be well-rounded. You need to volunteer. I mean, the list went on. And as the list compounded, the stress in my kids, I could see it myself. Their stress levels going up. And as a parent, I had to help, moderate that for them, the conversations with the school, and I had to help them prioritize, all right, let you take that AP class and you're doing, this club and this sport, but how about we leave off volunteering for now, but there's a lot of pressure put on kids these days to, quote unquote, get into a good school. And that conversation is the same for your special needs child on an IEP, all the way up to kids who are in all AP classes. The same conversation occurs. So I conversations with kids in our care. There's not necessarily a conversation that happens with kids at the level at which they're at either. And I think that maybe that's something schools can work on a little bit more, is meeting the kids that are in the actual system, their education system, where they're at with regard to where they're going to be able to go and what they need to do to get there. But I can't even imagine being in Nick and Jabeen's shoes right now, because I feel like school's changed a lot since I've been there. I don't remember all these pressures when I was prepping for college, but it's every kid that went through in my own family, I felt like each year they added something else to the list that you needed to be doing to get into that good school.
So great points. Now let's talk about peer-to-peer. Let's say, Jabeen sees Nick, being a little volatile, just like out of sorts. What can students do to support their friends? And then, that's a larger question. And then what I would like to follow up with is, like, Nick and Jabeen, what do you think students are going to feel comfortable, or what would you feel comfortable saying to your peers? So we'll start with Kathleen and then we'll move to Nick and Jabeen. So Kathleen?
Yeah, so your friend group is your family, right? In your adolescence, in your young adult years. If you see your friends beginning to struggle, so some signs and symptoms that adolescents are going through some personal struggles that we see, that families report to us, or that we see within our own families. I think everybody can kind of identify with this. Kids tend to start to isolate. They pull away from their friend groups, or they change their friend groups totally. They go from hanging out with kids that they hung out with from kindergarten to 8th grade, and they hit 9th grade and they fall in with a totally different crowd, a self-destructive crowd. They isolate, they become irritable, or they isolate and they don't talk to anybody, or they stop going to school, or they start missing a lot of days, or they start failing tests. And you notice these things within your friends, and you have a I don't want to say an obligation, it's not an obligation, but that's like a cue that if you're comfortable doing it, to reach out to them, to go up to them in the cafeteria and say, hey, is something going on, Nick? You seem, I don't remember the word Serena used.
Irritable.
Well, out of sorts.
Well, I can say irritable too. Sorry, Nick.
Volatile, that was the word. No, you don't seem yourself. Is there something going on? Is there something that I can help you with? Keeping the dialogue open with your friends who seem to be struggling is important. And I caution by saying that if you get information about one of your friends that moves into the realm of serious, right? If they're having thoughts of harming themselves, or if they're really starting to use language that's scary, like, I don't want to wake up tomorrow, or this has become just too much for me to bear, you might need to pull in an adult, encourage them to talk to a teacher or guidance counselor. I know that's hard for kids to hear. And sometimes, you even might have to intervene with telling your parents so that your parents can reach out to your friend's parents, because obviously safety always has to come first. But you'd be surprised, just going up to someone and saying, having a little bit of empathetic, dialogue with them. I clearly, I can see that you're struggling. Why don't you tell me what's going on with you? It makes a huge difference. In somebody who's struggling, just to have somebody come up and say, I see that you're struggling. Why don't you tell me what's going on? Yeah.
And thank you, Kathleen. So Jabeen, Nick, hearing all this, what do you think, or what would you feel comfortable? Would you feel comfortable doing what Kathleen is suggesting, or what do you think others will feel comfortable doing?
I definitely agree with everything Kathleen just said. I think for me, peer-to-peer connections are so important. And I know that I rely so heavily on the support from my friends. And I would definitely feel comfortable reaching out to a friend if I see that they're struggling, or vice versa. And I would definitely feel comfortable talking to a friend about my struggles. And I think that for a lot of students, it might be kind of uncomfortable to talk to parents or teachers, just because it might be an awkward conversation. So I would definitely go to my friends as a first line when I need help.
Great. Nick?
Yeah, I would definitely agree. I think that peer-to-peer interaction is definitely what we as students are most comfortable with, because it's kind of awkward when you're trying to convey those feelings to an adult. And personally, for me, if I was trying to help a friend, I'd try to take them out of that environment. Because I can drive, I can always just drive over, pick them up. Don't even have to face the burnout directly. We can just talk about life. I kind of bring them out of that environment so that they can take a break from whatever was exhausting them. And afterwards, hopefully they have a better mental state, I guess, in order to go back into whatever they were trying to do.
Great. And thank you. I think that's really important to share, and also, to really encourage those interactions between peers. So thank you all for that. So I know we've been talking a lot about burnout, but now I want to turn it over and take a look at imposter syndrome. So Kathleen, for our audience, if you can explain what imposter syndrome is and what are the signs and or symptoms of it.
Sure. So imposter syndrome is traditionally found. It was identified in successful adults that made it to be Fortune 500 company CEOs and people who are extremely successful in their careers, lawyers, doctors, that they hit a point in their career trajectory where they felt like they didn't really deserve to be there, that they would describe it as, somebody's going to know that I'm faking it. I don't really know how I got here. I'm not experienced to be here. When they clearly had the education and experience to be there, it was a internal feeling that they had. It's attributed really to self-esteem and the ability to be self-aware of how you got to where you are, and that you're good enough and have enough self-worth to be where you are. As I shared with Serena, I was surprised when I was asked about this for adolescents and young adults. But going back to the conversation we had earlier about the pressures that we're putting on kids these days to compete with each other, to get into schools, and to, take on a ton of tasks to prove our worth for college or, for school, I could see where this is starting to affect our youth too. And it's not scary, but it's kind of sad that we're there. Yeah.
Yeah. So Nick, have you experienced, imposter syndrome? Can you maybe share if you've had some of your experiences?
Yeah, I definitely have experienced imposter syndrome actually recently in my summer camp. So I'm doing a summer camp under the Warden School at UPenn. And in this program, we're given this opportunity to connect and network with other students who are participating. And in this network, people introduce themselves, put what they like, and some of them put their resumes. And as I'm looking through all these people that are apparently in the same program as me, I just see all their different accolades and achievements, like starting their own small business and running a nonprofit at the same time. And I am in the same program and I haven't done either of those. I don't have a small business and I don't have a nonprofit that I run. So I kind of just felt out of place in this program originally because I didn't understand whether I should be there when there were all these people with better resumes than me. And there were people who didn't make the program who might have had better resumes than me. So I always just felt a little bit of imposter syndrome looking at all these competitors at the summer program. So yeah.
Yeah, and I'm sure you're not alone. So let me ask Jabeen, have you ever felt like you didn't deserve success you've had? And if so, what were some of your specific experiences that led you to feel that way?
Yeah, so I had an experience very similar to Nick. When I think about imposter syndrome, I think about my time in AP chemistry, which I just finished this school year. And I remember walking in the first day and just feeling so intimidated by all of the other students in my class because I was thinking, oh my gosh, they're so much smarter than me. Like they have all this background they all have this like background information in chemistry that I don't have. And it produced a lot of feelings of self-doubt. And I kept thinking to myself, like, I don't deserve to be here. Like I'm not smart enough. And when I would get a test grade back, I would do well. And I would think to myself, like, oh, it was just an easy test, or like the concept wasn't that hard. And that's why you did okay. When in reality, I had put in the work and I had studied for the test. And that's why I did well. And, it took me a long time to realize that I shouldn't be shocked if I was doing well because I was just as capable as any of these other students in the class.
And thank you for sharing that. I want to just kind of circle back on something kind of Nick said, with a lot of students having nonprofits and being on, computers and in social media. I'm wondering, just has social media actually helped to increase those feelings of imposter syndrome, the ability to be able to just sit there and know what somebody else is doing? So I'm going to, I guess, turn that question over to Kathleen.
So yeah, social media plays a huge part in not just the imposter syndrome or imposter phenomenon, but also, just to put it out there in our eating disorders unit as well, right? So we have an entire group dedicated to social media because, kids are raised on computers and iPhones and media. You're like the media generation. So everything is digital. And what we're seeing in the media, kids take at face value at a young age that this is how it's supposed to be. This is who I'm supposed to be. This is what I'm supposed to look like. This is how, I'll get a job. This is how I'll get a boyfriend if I look like this, or if I have this, or if I do A, B, and C, I'm going to obtain D, is really driven by what children at a very early age are being influenced by what they're seeing on social media, on TV, on the computer. There's no question. And we dedicate an entire group to breaking down social media, what actually, the harmful pieces of social media. Don't get me wrong, there's obviously positives to it too, but I think that the comparing of oneself to what the media portrays exacerbates, the imposter syndrome creeping up. Yeah.
So then what advice can you offer teens on how to manage imposter syndrome?
Sure. So it's the same advice that we give to behavioral health patients, throughout the whole system, and patients who are in our outpatient or who are just getting traditional outpatient like therapists and psychiatrists. One of the first conversations we have with patients when they're struggling with self-esteem issues is we use the term to reframe and self-reflect. So taking stock in where you're at, what you've done, putting on paper and putting it down for yourself to see the achievements that you've done, the things that you've done, ways to validate that you have earned where you are, that, you may think that, this scenario is going on, but when you put it down on paper and you actually reflect and reframe the situation, just to look at it, that you realize that, your thinking is a little skewed because of your self-esteem or stress or other things going on within your life at that point, that you've lost sight of what the reality is of what actually is going on. So I like reframing thinking, and I like to encourage patients when they're really feeling like, they've accomplished nothing, to do a journal it out and see where you've actually been and what you've been able to accomplish. It helps to put things into perspective.
Sounds like great. Thank you. That's great advice. So, Jabeen, Nick, is there anything that you have found to be effective in combating those types of feelings? So
Yes.
we'll go with Jabeen.
I think, like Kathleen was saying, a lot of high schoolers tend to compare themselves to others, which can really make it hard for students to accept their accomplishments and be proud of what they've done. So my biggest advice, especially as a high schooler, would be to kind of just focus on yourself and block out what everyone else is doing, and just keep reminding yourself that you're worthy of everything that you've accomplished, which would really boost your self-esteem. And I know I've done this a bunch, and it's helped me a lot. And I definitely recommend other high schoolers take this advice.
Thank you, Jabeen. Nick?
I would definitely agree. I think that putting yourself in perspective, just looking at yourself rather than at other people, definitely helps. I also think that understanding that everybody has different circumstances, and as Kathleen was saying, looking at all the work that you put in to get to where you are can really help you become more appreciative of what you've done rather than feel down because of what others have done.
Yeah, thank you. Now, I wanted to just kind of come back to something that Kathleen, you had mentioned earlier, students feeling from this type of syndrome, from those in the AP classes, all the way through the continuum of even students in an IEP. And so what I'm wondering then is, what can, teachers and faculty and, maybe even some of the school nurses who see these children frequently, what can they do to address imposter syndrome?
So you bring up a good point, because I don't think that imposter syndrome, I don't want to give the message that it's just the overachieving students, as or the students that strive to do a little bit more with their education, versus kids who maybe are looking to go into electrical work or trade. I think it affects all kids at this point equally, because, and if you think about it, put it into perspective, right? So you have in one classroom, maybe you do have a child with an AEP, and you do have kids who are in AP classes and an IEP kid together. That IEP kid could also be questioning, how did I get into this class with Nick or Jabeen, who are in AP chemistry, and I've got an IEP and I'm thinking about going this route. So they may be comparing themselves as well. So I think to combat it, or to help kids manage it, much like doing the individual work to look at where you are and how you got there, I think that teachers and parents both at home can celebrate small successes and really acknowledge the small steps along the way of kids' accomplishments. Honor those accomplishments, and make a big deal out of the accomplishments that your children make, even if it's non-school related, just things that they do to enhance their interests. If a child volunteers at an animal shelter because they have an interest in becoming a veterinary technician, celebrate that. Celebrate the steps that they took to get that knowledge and to move forward to what they want to do. And if your kid volunteers at an animal shelter because they want to be the veterinarian instead of the tech, celebrate those accomplishments and those things that they did to move towards their goals too. I do think social media plays a huge part in this with adolescents. After doing some thinking on this, because again, I was a little shocked to think, and it never even dawned on me that kids would be dealing with this, but it makes sense with the kinds of pressures we put on kids, from your AP students all the way down to students who have an IEP, but maybe in, general classes in the school, the comparing of themselves to each other and comparing themselves to what they see on TV or where they think they should be. Just really with everybody under your purview as teachers and educators, just really celebrating the steps that they're making to reach the goals that they want to do, and pointing out the steps that they're taking when they don't even realize they're taking them a lot. And that's why that taking stock in your individual accomplishments is so important, because we do so much that we forget some of the stuff we did to get to where we are, right? So helping them to recognize that in themselves is important.
Yeah. So it sounds like, whether it's teachers or school nurses, faculty, or maybe even family and friends, it definitely sounds like, acknowledging and celebrating the accomplishments of each child, or each student rather, is really a way to combat some of that imposter syndrome. Is that correct?
Yeah, I saw, there was a quote, I was thinking about this last night. I was prepping for this. Somebody had put up a quote, it's graduation time. It's great to celebrate all the colleges that, your AP students went to, but be that teacher that asks the student who wasn't in the AP classes where they're going next. Yeah.
Very good thought. So I just want
to, it's important, right? We want to make sure that we're celebrating everybody's successes.
Absolutely. Yeah. Very good point. So Jabeen and Nick, does that sound like, hearing through your peers and knowing what you're going through, with somebody celebrating your accomplishments, does that help? Would that help you? And or do you feel like there's anything else that family or friends could do to assist you? So we'll go to Jabeen first. Sorry, Nick, we always do the ladies first.
I definitely think that schools need to make more of an effort in kind of like praising their students on the simple accomplishments, because I know I would really benefit from the encouragement of my teachers, even if it's something simple like getting a good test grade or getting a problem right. I think that those gestures mean a lot in the long run. I think friends and family can kind of do the same thing, and just kind of like boost up my self-esteem and give optimism to students. That would really help.
Nick?
I definitely agree. Like, the main problem with imposter syndrome is that it's mostly an internal struggle, that we see ourselves incorrectly or we don't value what we've done. And I think that providing support for people who are suffering from imposter syndrome or who are experiencing it definitely helps in giving that individual the confidence in order to value what they have done rather than look down upon themselves.
Great. Thank you both for sharing. I always feel it's very helpful to get a student's perspective as well. So no, Kathleen, as the director of Robert Wood Johnson University Hospital Somerset's eating disorder program, can you maybe discuss how some teens turn to eating disorders as a way to cope with, anxiety and depression, and what the signs and symptoms of eating disorders are, and, what help is available for them? I know that was a three-part question, so sorry. He who's watched me before knows I can't just ask one question.
So I'll start with how where eating disorders can develop out of mental health issues. So an eating disorder in itself is a diagnosable mental health issue. It's in the DSM diagnostic book, but it never usually comes alone. It's usually secondary to anxiety, depression, We do have patients with bipolar disorder, schizophrenia, substance abuse who suffer from eating disorders. And my alarms are going off. I apologize. So yeah, so it's usually secondary to, it usually comes after the initial mental illness diagnosis. That's not always the case, but and 9 times out of 10 in the adolescent population, it's anxiety and eating disorder and depression and eating disorder. So, you know, patients use eating disorders as a way to self-soothe. You know, they can purge to self-soothe. It's a form of self-harm, self-destruction to themselves. There's many different types of eating disorders. Our eating disorders unit here at Somerset treats the spectrum of eating disorders. We have anorexic patients, we have patients with bulimia, we have patients with binge eating disorder, we have patients with an eating disorder called RFID, which is an eating disorder where kids struggle with being able to swallow the food. They have a fear of eating, usually from childhood trauma, a choking incident when they were younger. It tends to run in younger children, but you know, we do see it in older children where it wasn't diagnosed properly in adolescence. And then we do treat occasionally patients with pica, where they eat unusual things like clay or you know, wood pencils, to give you a couple examples. And here at Robert Wood, we have 3 levels of care. We have our inpatient eating disorders, where we take patients who are quite ill. That's what, you know, I don't want to get into specifics of how you, you know, get qualified for the inpatient unit versus partial, but we do have an inpatient unit, and then we have a partial hospital program, which is Monday through Friday. It's from 10 o'clock to 3:30. And then we have an IOP, which is intensive outpatient. So that's 3 days a week, half-day programming.
Okay. So, I mean, the important message here is that if you or your loved one has these signs, correct, that they should be reaching out for help.
That's what I missed on your thing, was the signs and symptoms. I was trying to remember all the questions you had.
So sorry, maybe I shouldn't ask those 3-part questions. But yes, if you could go over the signs and symptoms, right? Again, for the audience, that would be great.
Sure. So obviously, you know, rapid weight loss, food avoidance at meals. If you see your friends, you know, kind of pushing the food around the plate, but they never actually really eat it. Rapid weight loss, some of the stuff that we talked about with burnout, or what's delving more into an anxiety disorder, like the irritability, the you know, stomach issues, fatigue, trouble sleeping, all of that, coupled with the weight loss or food avoidance, or avoiding, you know, social situations, avoiding eating out. If you and your friends went out for years every Friday night to hang out at the diner, and then all of a sudden one friend doesn't want to go anymore and they're avoiding stuff, and you're seeing some of the other stuff, those are signs and symptoms that you should be looking at for possible eating disorder. And it would be the same advice that I would give to the school nurses in a school. They're usually the ones that pick up first that there's possibility of an eating disorder with the kids. And somebody says to the nurse, you know, can you take a look at this kid? I think they've got some significant weight gain, and they don't seem to be eating their lunch. You know, we usually get the call via the school nurse. And the parents, it's, you know, if they're avoiding sitting at the dinner table with you, they're pushing food around the plate, they seem to be hiding stuff, or, you know, doing the just the food avoidance in general with the rapid weight loss, it would warrant an assessment.
So if somebody suspects or, you know, sees these signs, what should they do? Should they call somebody? Is there a number they should call for you?
Yeah, we have an access center that you can call, and they'll link you to us for an appointment. The patients that come in, or clients, depending on if they go to partial or if they go to inpatient, come in for an initial eval. Everybody starts in our access department. And then at the time of the evaluation, we determine whether or not the patient is appropriate for inpatient or for partial hospital, depending on their labs, their EKGs, their vital signs, and their percentage of ideal body weight. To see where they're going to be better suited for treatment, whether it's inpatient or if it's partial. Also, we look at their eating disorder behaviors. For adolescents, a lot of times the school nurse will intervene, call the parents, and we get a call from the pediatrician. A lot of pediatrician referrals because they're seeing that on the child's growth chart, there's a rapid decline on the curve. It's not a normal curve anymore.
Okay, so I think we'll try and post that that access number into the chat. I'll mention it later on. But just one last question.
Sure.
So, you know, Jabeen or Nick, they're at school. They notice, you know, that one of their friends is experiencing this these signs. You know, of course, they're not going to be walking around with the access number, but so what should, from a peer-to-peer perspective, what advice can you give Nick or Jabeen that if one of their friends is experiencing the signs, what do they do? Because I'm sure it's got to be a little bit uncomfortable. Would you
Sure.
both not agree? And so if you could give them some advice, and Nick, Jabeen, let us know if you feel like that would be something you'd be willing to do. You know, that would be great. So Kathleen, why don't you go first?
Well, I think it goes back to what we talked about earlier, right? Reaching out to the person that you're concerned about. You know, even just going up and saying, you know, I seem to notice that you're not going out with us as much. You're struggling at lunch. You don't seem to really be, you know, eating anymore. Is something going on? I'm here for you. You know, being empathetic, being in the moment with them to ask if there's anything you can do, if there's anything going on. But again, the caution there, if you notice that, you know, your friend has a significant loss of weight or is exhibiting serious behaviors, this is where, unfortunately, and this is the uncomfortable part, right? Because, you know, you're an adolescent and you don't want to, you know, upset your friend group or upset your friend. This is a tough spot to be in. But if you notice those things, you know, unfortunately, eating disorders are the number one for mental health issues. It has the highest mortality rate. It's an extremely dangerous illness because patients who lose 50, 60 pounds rapidly, they may look okay on the outside, but on the inside, their heart is struggling, their kidneys are struggling, their respiratory rate is not functioning optimally, their oxygen levels are down, their labs are messed up, their EKGs are abnormal. It's an extremely dangerous illness. So, you know, the caution here is if it's something above and beyond what you can handle with your friend, there's a point at which, and this is the tough one, but sometimes you have to do it, where you might have to talk to your parents or talk to another adult that also knows this child to help intervene for assistance.
So Nick, Jabeen, your thoughts? Would you feel comfortable?
Yeah, I think
intervening?
I think I would definitely feel comfortable, especially if my friend was at risk for a more serious issue. I think that, again, I would just have to approach them with a really empathetic tone and just explain that I'm there for them, and that if they need anything, then I'm there. And if it is more serious than that, I would definitely feel comfortable reaching out to their parent or my parents, or giving them the helpline that we just posted in the chat.
Nick?
I'm not sure whether I would be entirely comfortable with that, but I think it's the job as a friend to help another friend kind of get through those times and kind of face it, if it's, you would call it an issue, but face that issue and help them combat those like difficult questions that they might have an eating disorder. And if it comes to it, consulting somebody who's older and can take action in order to help them alleviate whatever problems that they're having.
Yeah. And Nick, and thank you for your honesty, because I am sure you are not the only student that would feel a little bit uncomfortable, which is why I raised the issue, because, it is a very delicate and touchy, situation, and some may feel comfortable and others may not. And we want to be able to help students help others. And so that's why we're sharing today and doing this webinar. So I want to be mindful of the time and give our audience opportunity to ask some questions of our panelists. So audience, if you do have any questions for any one member of our panel, please post them again in the question and answer section. I see right away that we do have one question already posted. So this is kind of a scenario. Sometimes it's hard for kids to tell their parents they are feeling overwhelmed because they feel this pressure to succeed. How would you recommend they start this conversation with their parents? So I guess, Kathleen, I will first have you answer that question from the professional perspective, and then I'm going to open it up to Nick and Jabeen, because I think there's a student perspective in here or a child perspective in here as well. So Kathleen, go right ahead.
So, with our adolescents that we treat, we have family sessions, and eating, and I'm using eating disorders as an example, because eating disorders is we like to tell the families that it's much like substance use disorders. It's a family illness, right? Everybody has kind of a piece in the eating disorder, whether they realize it or not. So when we prep kids for their first family session, we have them write down everything that they want to talk about with their parents. And much like kind of taking stock in where you're at and what you're doing, and doing a little self-reflection and cataloging of what you've done, we have them list all of the things that they want to discuss with their parents. And then we don't do that all necessarily at the one meeting. We prioritize what areas that we want to touch on first, and then maybe we save some of the tougher conversations with the parents towards the end, after we kind of get the family meetings going and there's a format to it and everybody's comfortable with the format. So to answer that question, I would take a very similar approach, because it's similar, right? You're having a discussion with your parents about something that maybe might be a little bit tough for them to hear and maybe a little bit difficult for you to say. So I would say prep the conversation points ahead of time. And I would maybe not go into it with the expectation that you're going to have one conversation and be done. It's usually never one and done when you're talking about, it's a system within the household that these things start to take place in. And I say these things, whether it's an eating disorder or it's the culture of the household, that everybody, including the parents, are overachievers. And that's just the culture of and I use that term overachiever, and I'm not meaning it's derogatory at all, but that they're driven, that they're, that they take on multiple tasks without blinking an eye, and they can continue to do that until they hit their wall. We never tell children that it's going to be a one and done conversation in our care. We have them make the list. We have them prioritize the list, but if you're going to go into that conversation, I would have your talking points, and and I'm going to be very honest. You're the one driving that conversation. It's a concern for you, and it's your self-care, and it's your mental health concerns, or burnout concerns that you're discussing. So if the conversation is going off the rails, then you have a right to shut that conversation down. You can, and that doesn't mean that you yell at your parents and say, I'm not having this conversation anymore, because when you come into that conversation, you want to come into it with maturity, because you want them to hear what you're saying. So saying something to the effect of, thank you for sitting down with me today, but I really don't think that we are having the same conversation here. We're on two different planes with regard to what we're discussing. how about I give you a copy of the list of stuff I wanted to talk about today so you can look at it, and how about we come together again in a day or two and you have time to look at it and I can reflect on what you said, and let's come back together and talk about it again. But this is very important to me, and it's important to my overall well-being, because this is what's been going on with me, and I really do need to come back and have this conversation with you again. And if that doesn't work, and this is a long answer, but it's an important one, and we do tell kids this, you know, in the state of New Jersey, you know, adolescents have a lot of rights in mental health, to seek treatment out and to get help for their mental health issues, exclusive of parents. You have guidance counselors at school that can help you. You have services in your community that you can reach out, and support groups that you can work with. And there's people that can help you mediate those conversations as well. So if you're really struggling to have that conversation with your parents, I encourage you to look for somebody that can help you mediate that conversation, you know, but ultimately know that the feelings that you're feeling, the stressors that you're feeling, and the physical manifestations you're feeling are real. It's just a matter of really bringing together, you know, a very mature conversation with them for them to understand, you know, really where you're at. And that was a long answer, but I hope that answers the question.
No, and thank you for that. We appreciate your advice and guidance on this. So Nick and Jabeen, so from your perspective, how would you like to start that conversation? So we'll go, Jabeen.
Yeah, I think for me, it would definitely be beneficial to kind of list out my talking points, like Kathleen said, and maybe make a list of what I'm feeling and why I'm feeling it, so that my parents kind of get a clearer picture of everything I'm going through. And for me, I feel like making suggestions of what my parents can do to help me, or maybe like suggesting like a task I can drop or an extracurricular I can drop so that I'm feeling less overwhelmed. I feel like that would probably help me. And just being like open, honest, and respectful, and of course, having a mature conversation.
Nick?
Yeah, I definitely would agree. I think the most important part is being mature in the conversation and entering with the idea that me as like the son and my parents are kind of on the same level, I guess. So I'd enter it like a negotiation and kind of see it as a conversation where we're trying to come to a conclusion where we both benefit, and that, what's it called? I'm blanking. But I definitely feel that being mature, trying to approach it at the same playing field, I guess. Like, I'm not a subordinate in this family. Like, we all have our values and we all contribute to the family. We're all important. And I don't want to minimize your importance, but I don't want you to minimize my importance. And just having that understanding definitely would help the conversation kind of go along more cleanly.
Thank you so much. And thank you all for your perspectives on that question. We appreciate it. So we have a really good question. So again, another hypothetical, but what happens when an 18-year-old recognizes she has an eating disorder, yet refuses to get help? How can a family support her? So I'm going to direct this one to Kathleen. So I'm thinking, folks, she's probably the right lady to answer that question.
So, you know, obviously in the United States, 18-year-olds are of legal age to make their own healthcare decisions, unless they're at a point where they're unable to make those decisions anymore, and that's a whole nother discussion. You know, Somerset's eating disorders philosophy on eating disorders is very similar to substance use disorder. So I often draw that parallel because it's a little easier to understand addiction and treatment than it necessarily is eating disorders. So we have a recovery-based model, much like the substance use disorders recovery-based models, with trying to move patients through the recovery process, meeting them where they're at, moving them through the stages of, losing their eating disorder, because there is a little bit of grieving when the eating disorder goes away. So I say that because a patient who comes in for eating disorders treatment needs to be voluntary and at the point that they're ready to get treatment. If they're not ready to get treatment and they're pushed into treatment, what you're going to see on the other side of that is what you see with someone who has a substance use disorder, right? If they're not ready to give up the drug or alcohol, they're not going to have a good recovery process. If the patient's not ready to give up the eating disorder, they're not going to have a good recovery process. Now, with that said, somebody who's 18 who is extremely medically unwell, we'll just say medically unwell, where they're to the point that they need hospitalization, that's a different story. That's where you could call 911, try to get them to the hospital, and let the hospital assist with negotiating some of that conversation with the patient. As I said before, with regard to looking at someone with an eating disorder, sometimes they look okay from the outside, but on the inside, their organ systems are a mess. Oftentimes it's getting them to that doctor's appointment or the hospital or the ED to get labs drawn and EKG done for someone to really realize how sick they are with their eating disorder, to kind of give them that aha moment that they need to seek help, they need to get treatment. What you can do otherwise is just really encourage them to seek out care and treatment. Be empathetic, be understanding, don't nag, to use the word. You can't nag somebody into recovery. They have to be willing to do it, but you can be there for them no matter where they're at within their, illness process, and just be a support.
Wow, thank you. I'm sure that's a very tough situation for family to see. So again, thank you for that advice and guidance. Any other questions for our panel? Okay, I don't see any. So if there's no other question, then this will conclude tonight's webinar. Thank you all for joining us this evening for this very informative discussion. Please join us for the second part in our mental health in high school webinar series on Thursday, June 24th at 5:30 p.m. for a discussion on what is mental health, talking about depression, school-related anxiety, and isolation. Go to our website at www.rwjbh.org/Somerset to register. Please remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. For more information about Robert Wood Johnson University Hospital Somerset's Behavioral Health Sciences or Eating Disorders program, visit www.rwjbh.org/Somerset or call the RWJBarnabas Health Behavioral Health Network Access Center for 24/7 mental health support at 1-800-300-0628. On behalf of Robert Wood Johnson University Hospital Somerset, our Somerset Healthcare Foundation Youth Board, and Friends Health Connection, thank you all for joining us this evening. Have a great evening and take care, everyone.